So, what are the red flags of neonatal jaundice? Number one, if the yellowing spreads to your baby's chest. Number two, if they are more fussy or they are not feeding as usual. Number three, hello beautiful people, welcome back to Baby's Nest. If you've recently had a baby or you know someone who has just had a baby, you might be familiar with the term neonatal jaundice. In today's video, we'll be diving into what neonatal jaundice is all about, why it happens, and most importantly, what you can do as a caregiver to prevent neonatal jaundice from occurring. And if it happens, how you can take care of your baby during that period. Neonatal jaundice is the yellowing of a newborn's skin and eyes due to the buildup of a substance called bilirubin in their bodies. To understand why neonatal jaundice occurs, let's take a look at what happens inside your baby's body. When newborns are born, because of the relative lack of oxygen in the womb, this creates an increased percentage of red blood cells in their blood. When red blood cells are broken down in everybody, including adults, a substance called bilirubin is produced. However, in babies, their livers are not fully mature to efficiently remove this substance. This leads to the buildup of bilirubin in their bodies. Neonatal jaundice is very common. 6 out of every 10 babies born at term and 8 out of every 10 babies that are preterm have neonatal jaundice. Most babies start showing jaundice around 2 to 3 days after birth, and it tends to clear on its own within 1 to 2 weeks. There are different types of jaundice. However, I'll be discussing the 3 common types of neonatal jaundice. The first one is physiologic jaundice. Now, this occurs after the first 24 hours of life, and it's usually due to their liver not being mature and the increased breakdown of red blood cells. The second type is breastfeeding jaundice. This occurs when a baby is not eating regularly. The third type is pathological jaundice. This usually occurs within the first 24 hours of life, and it's usually due to different conditions like ABO incompatibility, which is when the blood group of the baby and the mother do not match. So how do you know your baby has jaundice? It's actually easy to spot. You don't need spiritual spectacles to spot jaundice. The yellowing typically starts from the face and goes down to the chest, to the stomach, and even down to the legs in serious cases. So what can parents do? Number one, monitor your baby as often as possible. You want to be checking their eyes and their skin, especially in the first week of life. Number two, feed them often as possible. Whether you're breastfeeding or formula feeding, the goal is to help them pass out the bilirubin in their stools. Number three, speak to your healthcare provider. If you're concerned about your baby's health, it's best to speak to your midwife or your doctor. So, how do we check for jaundice at home? It's best to be in a well-lit room with natural light. You would want to press on your baby's forehead or on their nose, and if the spot you pressed on turns yellow, then it's most likely your baby has jaundice. However, the yellowing might be more difficult to notice if your baby has darker skin, so it will be best to check their eyes. You could also look under their tongues as well. If you have any concerns, any suspicion of jaundice in your baby, it's best to give your healthcare provider a call. So, what are the red flags of neonatal jaundice? Number one, if the yellowing spreads to your baby's chest. Number two, if they are more fussy or they are not feeding as usual. Number three, if they are more difficult to wake up or they are more sleepy than usual. The last red flag is if you notice yellowing in the first 24 hours of life. These are signs that the bilirubin can be too high and your baby will actually need treatment. It's very important that neonatal jaundice is treated if indicated, because it can lead to a complication known as kernicterus, which is when the brain gets damaged. This results in lifelong disability. Moving on to treatment, it could be natural or the use of phototherapy. The natural treatment I'm referring to is feeding your baby more often, at least 8 to 12 times a day. Even if your baby is sleeping and you don't want to wake your baby up, it's best to actually wake your baby up after 2 hours, at most 3 hours, because you don't want your baby to go for that long without eating. The more you breastfeed, the more the bilirubin leaves the body through their poo. The next form of treatment is phototherapy, which is when your baby is put under a special blue light. This light helps to break down the bilirubin in your baby's blood, and they can excrete this as poop. Remember, neonatal jaundice is very common and it's really nothing to worry about. However, it's best to be well informed so you can feel confident and well prepared to prevent neonatal jaundice or handle it if it occurs. If you're still watching up to this time, you are the real MVPs. Thank you so much. If you found this video helpful, be sure to give it a thumbs up, and please subscribe, share, and turn on post notifications so that you don't miss out on more helpful videos. And hey, if you have any questions about neonatal jaundice or anything else, please drop them in the comment section below and I'll be attending to them.